Imagine a world where chronic disease management is no longer a constant struggle, but a streamlined process. Would you believe it? Picture a life where technology and medicine intertwine, where artificial intelligence and the Internet of Medical Things work hand in hand to ease the burden of long-term conditions. Can you envision the relief, the newfound freedom? It may sound like a far-fetched dream, but it's closer to reality than you might think. In reality, we are not far from this future. Let's dive deeper. AI and the Internet of Medical Things, or IoMT, are not just buzzwords. They're transforming how we manage chronic diseases. Consider the case of diabetes, a condition that affects millions worldwide. Traditionally, managing this disease has been a constant daily effort. However, with the advent of AI, we're now able to predict disease progression with a precision that was previously unattainable. Imagine a system that can analyze a patient's health data, identify patterns, and predict blood sugar levels hours in advance. This isn't science fiction, it's happening right now. Such a system allows patients and doctors to anticipate and prepare for changes, making disease management more efficient and personalized. Now, let's take a look at asthma. This is another chronic condition that has seen significant improvements thanks to the Internet of Medical Things. Smart inhalers, for instance, are a game changer. These devices not only deliver medication but also track usage, providing valuable data that can help patients and healthcare providers better understand the disease. Moreover, these smart inhalers can send reminders to patients about when to take their medication, improving adherence and overall disease management. The result? Fewer hospital visits, less distress, and a higher quality of life for patients. Indeed, the potential of AI and IoMT in revolutionizing chronic disease management is immense. These technologies are not just improving lives, they're saving them. AI and IoMT are game changers. But what does this mean for the future of chronic disease management? Let's take